Well, how those care levels that hospice provides are defined is basically through the federal government, which funds most of hospice through Medicare and Medicaid. And they stipulate that 4 levels of service need to be provided. The basic level of routine care is the care provided to a typical hospice patient within his home. That would include the nurse coming weekly, the nurse's aide coming several times per week, the social worker on a monthly basis, and the chaplain at least once a month and as often as necessary. The nurse case manager can step up the intensity, frequency, and length of those visits as necessary to meet the needs of the patient. Sometimes in the home setting, the family and friends who are providing for the support of the patient become fatigued or have an urgent need to be elsewhere. And under those circumstances, we can offer a respite benefit to the patient and family. And that is to have the patient come to the McCall House and stay with us for 4 nights and 5 days. During that time, they're considered to be routine patients at home. The level of care is essentially the same. But we have the nurses provide medication, and our volunteers often get involved in keeping the folks happy and occupied while the family at home is catching their breath or going to the away football game they really need to make, or some other important family matter. The third level of care is called continuous care, and that is what is called for when the patient's needs for intervention in the home setting become acute. And that continuous is a slight misnomer in that it means that the Open Arms Hospice has to be in the home for 8 hours in a 24-hour period. 4 of those hours have to be skilled nursing care by our RN. The others can be chaplain and aide and a conglomeration of services available. That is generally necessary when the patient's final hours are approaching and their symptoms are becoming more difficult to manage, and we're needing to make changes on an hour-by-hour basis and drug dosage. I'm usually not physically present for those, but I will be available by phone to support the nurses' diagnoses and recommendations for changes in medication. And finally is GIP, or general inpatient care. And that's the care provided to a patient when symptoms are such that they can't be managed in the home setting. Often that will involve complex dressing changes that need to be done frequently, or the provision of intravenous medications. And that will require a nurse at the bedside. Sometimes it's just a matter of, just as in the continuous care, of a fluid situation that requires hourly assessment and changes in drug doses and initiation of new drug therapies to control the patient's symptoms and make them comfortable. Most often that will be patients who have a pain crisis. Not uncommonly, patients will slip into a state of delirium, lose touch with reality, and sometimes become agitated and fretful and need medication and reassurance on an hourly basis to get those frightening symptoms under control.